This is the Fertility Friday podcast, episode number 83. Welcome to the 83rd episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from FertilityFriday.com, and this is your source for information about the fertility awareness method and all things fertility. I started this podcast because I believe that every woman has the right to know exactly how her body and her fertility works. I'm here to connect you with the tools and information that you need to improve your menstrual cycle health and fertility naturally. And I feel so privileged to be able to share my passion for body literacy and fertility awareness with you every single week. Fertility awareness is so much more than just birth control or trying to get pregnant, because it truly gives you a window into your own health and fertility. And I love sharing my expertise with my clients and helping them to understand their charts and connect with their cycles. If you've recently discovered fertility awareness, but you're not feeling so confident about using it just yet for birth control, or if you've been charting for a while and you're having trouble making sense of what's happening in your cycle, I can help. Get started today with a 15-minute consultation with me by heading over to fertilityfriday.com/coaching, or just click the Work With Me tab on my website. And I'd like to invite you to sign up for the Fertility Friday newsletter. This way, you'll always be the first to know when I release a new podcast episode or blog post. Just head over to fertilityfriday.com/ebook, and as a gift to you, you'll receive a free copy of my new ebook, where I reveal what to expect when coming off of hormonal contraceptives, and I share 5 steps to restoring healthy menstrual cycles post-pill. And before I get into the interview with Dr. Kerry Hampton, I just wanted to note that we were having some audio issues, and I did my best to smooth out the audio, but you'll notice that the audio quality isn't exactly the greatest. You'll just notice that there's a bit more feedback in this episode. So, bear with it if you can, because there's a ton of amazing insights that we get from Dr. Hampton. And let's roll. And in today's show, I'm very excited to welcome my guest, Dr. Kerry Hampton, back to the show. Dr. Hampton is a nurse, midwife, and a natural fertility specialist. She assists women to avoid and achieve pregnancy naturally through knowledge and a holistic approach to wellness. And in case you missed our previous episode together, make sure to go over to fertilityfriday.com/20, the number 20, and take a listen. It is to date one of my most popular episodes, and in our previous episode we spoke at length about the role that cervical mucus plays in a woman's fertility and why mucus is so essential and crucial to the process if you're trying to get pregnant. And in today's show we'll be talking about Kerry's most recent publication, a study that delves into how few women are able to correctly identify their fertile window, even if they think they can. And so we'll be talking a lot more about that and the implications that these findings have for women who are trying to get pregnant. So without further ado, welcome to the show, Kerry.
Thank you, Lisa.
Thank you so much for coming back. I was really excited to have you back again. And for our listeners who aren't familiar with your work, perhaps you could start by telling us a little bit about what you do, and also delve into the research that you most recently did.
Okay. Well, I am a nurse and a midwife, and for many years I've had an interest in women's knowledge and understanding of fertility and how that affects their reproductive experiences and the choices that they make. And over the last decade or so, I have more and more focused on infertility, women's knowledge of the menstrual cycle when they're fertile, when they're attempting pregnancy. So that's what brought me to undertaking a PhD, which I completed late in 2014. And in that work, what I aimed to do was to develop up a new model of care, infertility awareness, in general practice. So looking at fertility awareness as one way of reducing infertility and unnecessary referrals for assisted reproductive treatment. So that's my background. In my PhD work, what I did was I looked at what women know about fertility awareness among those who attend ART clinics or IVF clinics, if you like. And then I compared that in a later study with what women know and understand about fertility awareness in general practice. So the study that I talked about with you last time was the assisted reproductive technology study, and the study that I'm going to talk to you about today is the one of women who attended general practice. So would you like me just to compare?
Well, I would. There was just one, just to kind of get our feet wet, I think one of the things that I found so interesting in the study that you recently did, and I alluded to it when I introduced you, is that even though women are reporting that they know when they're fertile, so they're reporting that they're knowledgeable, when you actually go through and, examine their knowledge, very few of them are actually very clear on when they're fertile.
That's right. Yes, that's right. That was a finding that I had in the ART study. So in that study, 87% actively tried to improve their knowledge of fertility awareness. 68% believed that they were getting the timing right for a pregnancy, but only 12% had a good understanding of the fertile window in the menstrual cycle. And then in the general practice study, 37% actively tried to improve their knowledge, but only 2.1% had a good understanding. So in both studies, women tend to overestimate the level of knowledge that they have. And that was a significant finding in both studies, because what it means is that women think they understand, but most actually don't. Therefore, women may be going to, or they are actually in fact going to assisted reproductive technology clinics without really first testing their fertility through correct timing. When I compared interest in fertility awareness among the two groups of women, those who attend general practice and those who attend ART clinics, what I found was that interest in fertility awareness rises very sharply, from 37% of women in general practice to 87% in women who attend ART clinics. So women who are having trouble conceiving have a very high level of interest in this area, but in both groups they're overstating their level of knowledge, which may be undermining their capacity to actually get pregnant.
And so to kind of rephrase, because I know over here in North America, I think we refer to things a little differently, but from women who are just in general practice, so just in their regular, not necessarily going to IVF treatment or assisted reproductive technologies, you found that 37% were very keenly interested in learning more about their fertility, whereas women who are then, of course, undergoing fertility treatments, which would imply that they have been trying unsuccessfully for longer, 87% then have a very keen interest in learning more about their fertility. I think your study's highlighting a really important and pressing point that women really want to know, and it's not only when they're trying, but then of course when they're trying to get pregnant unsuccessfully, then they really want to know. But then one of the questions then is, and this is something that you talk about a lot in your research, is are the practitioners that they're going to capable of really helping them to improve their knowledge about their reproductive, about their cycles, about their fertility, about their fertile window?
Well, that's a really important question. I'm not quite sure what happens where you are, but here in Australia, for women to get access to ART treatment, they need to go to their general practitioner, and it's their general practitioner who would make an assessment and referral if they consider necessary. In another study that I did, I looked at what knowledge was of fertility awareness among general practitioners here in Australia. It was a a national survey, and consistent with the findings of women in the art study. So most women in the art study were practicing rhythm, that is counting days. And we know that for women, even among those who have a very regular monthly cycle, rhythm is only accurate for about 25 to 30% of cycles. And what we found was that general practitioners were basically teaching rhythm to women who were reporting trouble conceiving, and they were teaching rhythm for a range of reasons. And the reasons were that they didn't feel that they'd had sufficient education in this field to fully educate women about their menstrual cycles. The other main barrier was time. They felt that fertility awareness education, comprehensive fertility awareness education, was time consuming. Rhythm is much easier to impart, so teaching women to calculate days up in their cycle. Temperature and mucus, which is much, much more accurate than rhythm, was considered a bit too consuming and a bit too complicated. But in saying that, the vast majority of those practitioners believe that women should get this kind of education, but in the way that they're currently practicing, that's difficult.
Well, one of the things I'd be curious to hear your perspective, because I think that there's been this wave of technology. I know we had just briefly touched on all the technology. We were talking about the different things that keep popping up, and nowadays most women have smartphones, cell phones, and there's so many apps now that allow women to track their menstrual cycles. Unfortunately, and in my opinion, I would say unfortunately, a lot of them are basically the rhythm method. And I wonder if women realize that that's what it is. When you have an app that tells you when you're going to ovulate, and it tells you when you're fertile based on a calculation done from your previous cycles. And then it tells you when your period's going to come based on those calculations. I wonder if women who use those really know that that is actually a version of the rhythm method, whatever it is.
I think that's a really important question. And I'm not sure that has ever been investigated through research. But my experience in clinical practice is that women think that rhythm is accurate, and in thinking that rhythm is accurate, they think that's all they need to know. And if they've been trying to get pregnant and they're using rhythm through their app, they think they have been getting the timing right. But when I then get them to start charting their menstrual cycle with more accurate methods, temperature and mucus, they're then able to see how inaccurate they understood their cycles through rhythm. So it's only by getting women to chart through mucus and temperature can they actually see how limited their knowledge was through rhythm. I think that the point you raise is really important, because women go to these apps thinking that they can practice natural contraception safely. Through rhythm, we know that rhythm is not accurate. They're at risk of unplanned pregnancy through rhythm. And then women who are trying to get pregnant, they just might not be getting the timing right through rhythm. So those apps are disappointing, really. I think even for the more sophisticated apps, the ones that do have information on them about temperature and mucus, they might be reasonably accurate. I don't know. I've not really seen a study that has investigated how accurate they are. The first thing is that women might be putting in the information relatively accurately, but their interpretation can often be incorrect. And I think that is a real limitation of even the better apps. My experience in talking with women who have been using these apps is that they misunderstand what the apps are actually indicating. And when women have more complicated menstrual cycles, as in the cycle that might be shorter than monthly or longer than monthly, that adds in another complication that women find it difficult to understand their menstrual cycle through apps. So yes, apps can be useful, I think, but there are also some limitations to them. And the worst ones of all are the rhythm apps.
Well, and I would even say that most apps then have the kind of rhythm incorporated into them. And, you know, it's not necessarily a bad thing, but if you don't have the kind of basic knowledge and understanding first, then it can kind of lead to this misunderstanding. And I think that some women who have, you know, kind of unremarkable cycles, like their cycles are just regular and healthy and robust, it's a different story. I think that since we're talking about the studies that you've done specifically about women who are trying to get pregnant and obviously having challenges getting pregnant, this information becomes critical. And I think even going beyond the app, if you, for instance, doctors, women alike, unless you've kind of been exposed to the fertility awareness method and been exposed to these teachings to really understand the role of mucus in trying to get pregnant, then your doctor is telling you, you know, well, you should ovulate around day 14. The internet's telling you, well, you should ovulate around day 14. So even if you're not using an app, you still kind of fall into that. And I've seen it where women, even though they know a thing or two about mucus, they're even though they see the information on their app for their own cycle and it doesn't match with this day 14 idea, they still are trying to fit their cycle into that.
That's true.
Yeah, and so even if like it's clear, like I'll look at the chart and be like, no, there's no temperature shift, for example. Right?
Yes.
The woman will kind of be trying to create one because she really believes, well, no, I always ovulate early. So it's this weird thing where even though, just like you said, even if your chart is saying something different, you're not interpreting it correctly because we're all just trained in this belief system around this 14-day stuff. Yeah.
Yes, that is so true. That is so true. And women with long cycles, say for instance, they might be ovulating, you know, around day 26, 27, 28. They're still of the belief, in my experience, in a number of women that I have seen, that they're still ovulating around about day 14. They might see the mucus sign of ovulation around, 26, 27, 28, but they dismiss it because it doesn't fall within their prior understanding of fertility awareness, or when ovulation occurs in their menstrual cycle. Mucus is a very sophisticated system of fertility awareness, and how women experience the mucus symptom of fertility is can be very, very different between women, and it can alter between menstrual cycles. So if a woman doesn't have a really good understanding of mucus, she could very easily just misunderstand fertility entirely. The other thing is temperature. Temperature is a fairly accurate method, a retrospective method of identifying ovulation. I found that even among people who were using temperature, most actually misunderstood the indication of ovulation through the temperature method. So a good number of women thought that ovulation was occurring after the temperature rise, just that, rather than before the temperature rise. And I found that same finding among nurses and general practitioners. There was a poor understanding of the temperature method or the temperature shift that indicates ovulation in the menstrual cycle. So women tend to have poor knowledge. They go to their health practitioners to talk about their fertility and perhaps get a referral to an art clinic. If their general practitioners don't have a good knowledge, then it is something that just simply is not well attended to, and women could be being referred to IVF clinics unnecessarily. Because we know that the ultimate test of a woman's fertility is getting the timing right. And if the timing hasn't been right in terms of intercourse within the fertile window, then a woman will not have tested her fertility. And in my experience, it's not unusual for women to get the timing wrong consistently over many, many cycles, particularly if they have long cycles where there are multiple attempts at ovulation. That's tricky, and it's very difficult for women to sort of read a book or read something on the internet or get accurate information from an app to actually identify and understand that particular cycle and where actual ovulation is occurring. I don't know if you want to talk about the irregular menstrual cycle, but somewhere between 16 and 26% of women will have an irregular menstrual cycle, and that would typically mean multiple attempts at ovulation before it actually occurs. For women who go to art clinics, one of the main causes of women going to an art clinic is for an irregular cycle, and I think it constitutes something like about 25% of the female factor fertility problems, and most of those female factor fertility problems, as they relate to ovulation, are related to polycystic ovarian syndrome, and that typically is manifested in an irregular cycle. So this is really critical knowledge for women to have, for them to be able to optimize natural conception.
With PCOS then, because it's obviously linked to infertility, is it possible for a woman to conceive, a woman who has PCOS, but and doesn't do any other interventions other than timing sex with mucus?
Yes, it is possible, and yes, women do get pregnant doing nothing at all other than timing, but multiple studies have shown now that if women take a comprehensive approach, as in understanding their fertility and then applying a number of lifestyles, as in a low GI diet and losing weight if they're overweight, exercise, etc. Those lifestyle factors can actually reduce the number of attempts a woman has in ovulation, and would typically make her cycles more fertile, and then with timing over a period of time, they have a good chance of getting pregnant. Polycystic ovaries is a really common, or polycystic ovarian syndrome is really quite a common condition, and it's a major cause of the irregular menstrual cycle. And with polycystic ovaries, just as you mentioned, there would be multiple attempts at ovulation before actual ovulation occurs. And in each attempt at ovulation, a woman would notice some fertile mucus. She might not see it visually always, but there will be the sense of it being there at each actual attempt. As long as ovulation is followed by what we call a sufficient luteal phase, that is, there is a number of days left in the menstrual cycle in order for a pregnancy that starts, for it to have sufficient time for implantation, and there needs to be at least 11 days in the menstrual cycle left between ovulation to when menstruation is anticipated for implantation to be able to occur. If the luteal phase is sufficient, then she has a chance of getting pregnant. It's probably the most rewarding work that I do, teaching women to understand their cycle in that kind of complex circumstance, because they get an insight through their menstrual cycle as to how the condition works, and by then attending to a number of lifestyles, as in low GI approach to eating, exercise, good sleep, etc., they can actually observe their fertility improving. So there would be less attempts at ovulation before ovulation actually occurs, and then when ovulation does occur, it would over time be followed by a sufficient luteal phase. And when that starts to happen, then they have a chance of getting pregnant. And in my experience, for women who have mild to moderate degrees of polycystic ovaries, that kind of change can occur in as little as a few months, from cycles that are long and irregular and infertile because the luteal phase is too short, to one that is less irregular, less attempts at ovulation, followed by a sufficient luteal phase, and then they would typically go on and get pregnant within 6 months of establishing fertile type cycles. And a fertile type cycle is a cycle in which there is mucus, there is ovulation, and then ovulation is followed by a sufficient luteal phase.
Do you find in your work that that women are open to kind of waiting, right? Because this is something that takes time. So, from what you said, it is possible for a woman to become pregnant if her cycles are, long and irregular. But obviously that's an indication that her health could use some improvement. And once she makes those changes, she'll see the reflection of those changes as her cycles start to get more into healthy parameters. But as you said, that takes time. So when you're working with women in those situations, and you see that the menstrual cycle is off and it's well outside of healthy ranges, how does that conversation usually go? Do you find that the women that you work with are receptive to kind of knowing that it might take some time before their cycles start to tighten up and look healthier and more fertile?
Yes, I do. In the main, women are very receptive. One of the things I think that can be really helpful in this situation is that when women have perhaps already a diagnosis of polycystic ovaries, or they've just decided that they'd like to now start trying to get pregnant, it's really quite useful if women come along and talk about their fertility in the early stages. Because in the early stages, you can get them to start charting, and you can point out what the various patterns within the menstrual cycle mean, and then the kinds of things that they can do to improve those patterns and make the cycle more fertile. And that usually works out very well. It's a little bit harder when women come along and have been trying to get pregnant for 2, 3, 4, 5 years. It can still work, and and understanding their cycle and their health through fertility charting is still a great benefit, but those women can feel a little bit pressured because they've been trying for so long. They can be feeling a little bit frustrated. And if they're getting into their late 30s and early 40s, they can feel really pressured with time. So if I was to give one piece of really, really good advice to women about fertility and optimizing their chances of getting pregnant, is to learn about their fertility actually very early on in the process. Don't wait until you've been trying to get pregnant for a year or more, which increases your risk of being referred on to an IVF clinic unnecessarily. I would say come along, learn about your fertility really early, and that will put you in good stead for getting pregnant more quickly, and it will put them in good stead for achieving optimal health before they actually do then fall pregnant. So unfortunately, through apps, etc., people think they understand, but what we know is that they don't. And it's only after, in my experience, sometimes after months or years with apps, that they do then sometimes then go on and speak to someone like myself. It's much better that they come earlier rather than much later.
Well, your research has highlighted a very specific challenge in the sense of what do you do? Because that would imply that, every woman just to some degree really just feels very confident in her knowledge. And she, you could just be dead wrong, but you're very confident that that's correct. And in my experience, that's how it always works, regardless of whatever it is. We all know what we know. The only thing I say is you don't know what you don't know. When I started charting my own cycles based on Tony Weschler's book, I thought I knew everything as well. And then when I started learning with the charting circle that I became part of, with women who were trained as educators and training, all of a sudden I learned all this other stuff. So, but I didn't know that I didn't know it. So how do you get to those women? How do we raise the awareness about these things?
Well, I think that people like yourself, in the kinds of interviews you do, you help spread the understanding that the menstrual cycle is a little bit more complex and variable than the 28-day standard menstrual cycle that women are taught about. And even what women are taught about, through books and magazines and perhaps at school. I talk to a lot of health professionals, so doctors, nurses, naturopaths, etc. And even in their health science courses today, they still talk about the 28-day menstrual cycle. And the 28-day menstrual cycle is that sort of whole setup, it makes it very easy to discuss, but it's not how women experience the menstrual cycle. The 28-day menstrual cycle is average from all variations, and if we were to teach individual women about the 28-day menstrual cycle, it might nowhere match what their actual experience is. For instance, even women who have, say, a monthly menstrual cycle, they may not be ovulating until about day 21, 22, 23. And that's not unusual in my experience. And so for them to understand that where they are ovulating for themselves in their individual cycles, they just need to go through the process of charting fertility charting. And if they don't, they're working on an average of menstrual cycles that might not reflect their own. I think that there's not enough understanding out there that women can have a monthly menstrual cycle but still not be ovulating around day 14. It could be much later. And so for women who are trying to get pregnant and they're having monthly menstrual cycles, they think that everything within their menstrual cycle would be working as they expect it would be working, ovulation around about day 14. But it's not until they start charting do they realize that that's just not the way it is for them. And even for women with monthly menstrual cycles who are ovulating much later than usual, you would apply those same principles that I've talked about in terms of lifestyle. Just healthy diet, healthy weight, healthy sleep, healthy exercise. All of those things can make a contribution to making menstrual cycles healthier and fertility healthier. And for ovulation to occur at a better time, more towards around day 14 than it otherwise would. But for some women, they'll never ovulate. They can have a monthly cycle and they'll never ovulate at around day 14. Their pattern could typically be, say, 14, 15, 16, 17. And for other women who have about a monthly menstrual cycle, their pattern might be 11, 12, 13, those days of ovulation. So women can only know their own menstrual cycle if they actually chart it through mucus and temperature. There's no simple way around that. That's just what they have to do. And for many women, in my experience, who understand how to chart their cycle very simply, and you don't have to do it in great detail. You can take notice of body changes or mucus changes very simply. It doesn't have to be complex, as some books suggest, and make simple notes towards the end of the day. They can produce terrific charts that give them great insight into their cycles and their fertility, and then being able to know whether their cycles are fertile or whether they're not fertile. And this is just as important for women who are wanting to take a natural approach to contraception as it is for women who are wanting to conceive. And even if a woman wasn't wanting to understand their fertility for fertility reasons, as in not getting pregnant or getting pregnant, understanding what happens within the menstrual cycle, to observe whether or not there are healthy patterns, is important, because healthy patterns reflect health, unhealthy patterns reflect circumstances that perhaps need attention. And it helps people understand how their everyday lifestyles can be health promoting, or they may not be health promoting. For instance, women who experience chronic stress in their workplace, and if they weren't taking a pharmaceutical that overrode their menstrual cycle, if they were having natural cycles, they could document their menstrual cycle, and they could see that stress was playing a really big part in their menstrual cycle, health causing late ovulations and short luteal phases. And for those women, it's hard for them sometimes to understand the role of stress and how it can actually make cycles non-fertile. It's not until they actually go through the process of charting can they really make the connections. It's a very visual connection that they can make. Charting their cycle, they can see ovulation is occurring late, and then the luteal phase is short. And if they see that happening cycle after cycle, and they know that their workplace or work life is really stressful, it will enable them to become clearer about that connection, and that can be highly motivating to make changes. They might not want to change their job, but they could make some changes in other ways that could enable them to stick with their job but actually be healthier while they're doing it.
Mm-hmm. You make so many important points. I think that so many women experience exactly what you're talking about, from identifying their cycles, as you were saying that, talking about the 28-day kind of myth. And I was thinking about my own cycles. So in 15 years of charting, I have never had a 28-day cycle. I don't think I ever have. I think I've had like a 27-day, but 31, 32, but I honestly don't think I've ever had a 28-day cycle. And if I did, it might have been once. And so that I completely resonated with what you were saying, and I've just had the good fortune of learning this information at such a young age that I never really was able to get into that thinking that my ovulation should be on a particular day. So I don't know what day I ovulate on because it's different. Some days it might be on 19 or whatever, but I don't know because I've never put so much weight on that day. Whereas I think most women really put a lot of weight on the day because they think that means something.
Yes,
even though it can be variable.
And in your experience, understanding your bodies more completely through an understanding of your menstrual cycle, has that enabled you to feel more comfortable in your body? And does it enable you to feel more comfortable about changes? So yes, that was a short cycle, but I know why it was a short cycle. Yep, that was a longer cycle, but I understand why that cycle was longer, that sort of thing.
Yeah, absolutely. And it really prevents me from ever worrying about it because you can always, and for me personally, I could always connect what I'm seeing in my cycle with what's happening in my life. So, I have said on the podcast many times, but right around the time I started charting, I was also diagnosed with hypothyroidism. So my cycles were actually unhealthy, whereas I had a very delayed ovulation. And when I first started charting, before I had that under control, my cycles would often be very long, and I did have like problematic periods that were really heavy. This was all a result of this kind of thyroid thing. And so then once I started making certain changes and started trying different things, then when my cycles would actually start to get better, shorter, less bleeding, less pain, no pain. Yay, I finally got there. But so that was my experience of it. And then if I did have like a shorter cycle or a longer cycle, I could see, I was really stressed out. I had exams or something, or I was traveling and, etc. So I could see those things in my cycle. And it's always been, there's just you don't have to worry about it. And if your period, so I never think to myself, when is my period going to come, like from the first day of my cycle? Because I know that when I ovulate, it's going to come for me about 12 days later. Right? Yeah. So it just changes everything. It changes like everything. The way that you look at your cycle and your body. And also I feel a lot more comfortable in my body. It just kind of comes with the territory, I guess.
Yeah, absolutely. It provides an insight into your body and body changes over the course of the menstrual cycle that technology simply can't do. When women come along, and it's not unusual for women to come along and say, "Oh, my cycle is a little bit, I don't have a normal cycle." And when I ask them how long their cycle is, they say, "Oh, it is, say, usually about 26 or 27 days, or it comes about 32 days. I don't have a normal cycle. It never comes exactly on 28 days." And so through this kind of work, I find it very gratifying to help women understand what is normal. And so normal is anywhere between 26, 27 through to 36, and it's quite normal for the cycle to vary at least or around about or up to 5 days over the course of a year under normal circumstances. So yes, helping women appreciate their body as it is rather than them feeling that many things are wrong about their body because it doesn't fit into the 28-day model.
I want to touch on that a little bit because recently in some of the work that I've been doing with my clients, it's kind of come up, this idea of perfectionism with regards to the cycle. Even if your cycle falls generally within healthy parameters, still really wanting that perfect mucus cycle and, aiming for that 28 days as if you're going to. So maybe in your work with women over the years, how have you addressed that when you see that a woman, because we've all just been told that it's supposed to look like this. And when you learn from a book, you see these perfect quote unquote looking cycles. Few women, have cycles that look exactly like they do in the textbook. So how do you address that issue of perfectionism for a woman wanting her cycles to be quote unquote perfect, whatever that means, right?
Yeah. I would approach that in this way, and that is that I would say to all women that each woman experiences their menstrual cycle differently, and each woman's menstrual cycle will be their own. It's not someone else's, and through charting you will get to understand what normal patterns are for you, so teaching women to have an individual understanding of their cycles rather than a pattern, a typical 28-day pattern, which is average from many menstrual cycles. So it's teaching women to appreciate variability, and variability is normal and healthy. We're not machines, and variability is understandable often in the context of a woman's life. And you've just touched on it, Lisa, just a bit before, like when you were doing exams, things like that, feeling a little bit stressed, then you would expect the possibility that ovulation might occur a little bit later, the cycle might be a bit longer, or ovulation might occur a bit later, but the luteal phase will be a bit shorter. And it's understanding cause and effect and just how the body responds to the circumstances of our life. So I don't ever really have a problem. Most people seem to sort of understand that fairly quickly, fairly early on, that the cycle is variable and it will change from month to month depending on circumstances. Then we usually come in with the sense that anything other than a 28-day cycle is not quite right. But from the first consultation, I think they would walk away feeling, well, that was a medical construct rather than really the way it is for individual women. Mm-hmm. More typically, women feel it's a little bit harder to learn about the cycle when it's longer and there are multiple attempts at ovulation, and they literally do look forward to making minor adjustments in their life. They don't have to make big adjustments in their life. They can be really quite minor adjustments in their life to bring about change so that there are less attempts at ovulation before they do actually ovulate, and so the cycle is shorter and sort of better patterned. For me, I think it's quite straightforward. And even in I think sometimes it's the way people understand things and the way things are generally phrased. For instance, a long and irregular cycle is it's not a correct type of cycle. Women shouldn't have that. I would say, well, a long and irregular cycle is a reflection of this, and this. Now, if you make these changes, your cycle will shorten and become better patterned. So sometimes I make the analogy of our body will respond to circumstances in a way that will try and be helpful. So say, for instance, women who are very stressed but wanting to get pregnant, and they chart their cycle and they can see that they're ovulating late and the luteal phase is short. One of the things I will point out to them is actually the body is trying to protect you against pregnancy because it's not ideal for a woman to be pregnant and highly stressed. This is actually a protective mechanism rather than something that is faulty. It's actually a positive mechanism that is trying to protect you and the pregnancy that you are trying to achieve. So I think that you can bring about a lot of change through a better use of language that is a more accurate reflection of circumstances, rather than the kind of language that we tend to be taught to use about the menstrual cycle.
Mm-hmm.
Does that make sense?
It does. And I really couldn't agree more. I think that one of the things that you touched on earlier as well with regards to not only women's understanding, but practitioner understanding. It's a particular, I think over the years, I've gone through different phases of frustration. But I've recently, I guess, just more have come to a state of acceptance. So my frustration is around the fact that this knowledge just really isn't there. So whether it's the individual woman that we're talking about, or if we're talking about doctors, naturopaths. And I think that it's so interesting that you can have a practitioner who is amazing in their field, people who I would go to and refer clients to. And as soon as they talk about a woman's fertility, they're saying stuff that is wrong. And so one example, very recently, an article has been going around my Facebook pages and all over the place about how fertility awareness methods don't work because a woman can ovulate more than once in her cycle.
Ah, right.
And so there's fully these articles running around. And I've actually heard, again, people who I respect, people who are health professionals, amazing in their own right, who will say things like, and a woman can ovulate twice in her cycle. And I've seen this specifically related to exactly what you're talking about, where a woman's body will try to ovulate. So she may have a surge of estrogen and she may have a mucus patch and then not ovulate. But some of these practitioners may be even testing their hormones, and they'll notice this surge, right? And then they'll notice another one. And then when they're talking about this, we'll say that she's ovulated more than once in her cycle.
Yes.
Drives me crazy.
So right.
It makes me want to just scream. But what do you do? But this just is a reflection of the fact that no one seems to have the degree of knowledge that is necessary in this area.
Yes, it's a common misunderstanding that women see mucus 2 or more times in a cycle. They think that they're ovulating 2 or more times in a cycle, and practitioners can interpret mucus like that too. There have been some books published. I'm sure you've had people on your program about the lunar phase of fertility. Yeah, I'm not convinced by that at all. I mean, I know that I know that our bodies are influenced by the moon, but whether you can spontaneously conceive outside the physiological phase of fertility, that's something I'm not convinced about at all. And I think that there are huge data sets that just don't support that notion. So, yes. From what we know from good research that has been done, that is, if a woman is going to ovulate twice in a menstrual cycle, the second ovulation will occur within hours of the first. And then once ovulation has occurred, the second phase of the cycle, the luteal phase, commences. And once that phase commences, then you can't ovulate again because it turns off the hormones that are responsible for bringing on ovulation. So yes, it's a common mistake.
Mm-hmm. Mm-hmm. Well, and I think one of the things that I've received a few emails like this as well, because I've had a lot of time to sit with this knowledge, right? Like I've been, mm-hmm. and you have as well, because mm-hmm. you've been working in this field for so many years. And so a lot of my listeners have, just discovered the podcast. And so if this is the first podcast that you're listening to, welcome. It's a lot of information to take in. And then as soon as you kind of get a little bit of knowledge and information about how a woman's menstrual cycle works and how fertility works and ovulation and all those things, all of a sudden you do start to see the lack of understanding. You start to, if you go to a talk and you're hearing someone speak, you'll notice that they're totally knowledgeable in their field, but the moment they start talking about a woman's fertility and her menstrual cycle, they have no idea. And so it's a systemic problem. I think your research really highlights the fact that it's like the blind leading the blind.
Absolutely. Yes, absolutely. In both of the survey studies that I did of women, women were going to the internet, and friends and family and GPs, basically. And what we know is that GPs tend to have poor knowledge. Friends asking friends is not likely to improve a woman's knowledge to any great degree, based on the knowledge that we have of women's general understanding of fertility awareness. So really, people do need to see trained teachers who understand the menstrual cycle in detail and have a thorough understanding of menstrual cycle variability and the underlying causes of menstrual cycle variability. It was interesting in both the survey studies that I did of women, trained teachers in fertility awareness were the least accessed sources of the information. And what we know from studies that have been done is that only trained teachers are consistently associated with good knowledge in women. And that's because trained teachers will help women understand their individual cycle, and cycles from one woman to another can be highly, highly variable. So what one woman knows about her fertility and her menstrual cycle might not be transferable knowledge to another woman, because the other woman's cycle might be very different. So yes, it is like the blind leading the blind in many ways. I'm hoping that through my work that this might change to an extent, because in the subsequent study that I did after the general practice study, looking at what women knew about fertility awareness, I surveyed both nurses and GPs, or practice nurses and GPs around Australia, and there was a high degree of agreement between these two practitioners that this really was important knowledge, that women should have access to this knowledge, and that they should actually be providing this kind of knowledge in general practice. And they nominated practice nurses as probably the most suited practitioners in general practice to deliver this kind of education education for women. So I'm hoping that down the track, within Australia at least, women will have greater access to this knowledge. Whether they are just wanting to learn about their menstrual cycle, or they're wanting to practice natural contraception, or attempt pregnancy. I should say that in the study that I did of women attending general practice, that 4% were using fertility awareness, as they thought, for contraception, but none of those women, none of the 4% actually had good knowledge. And what we know from other studies is that a significant proportion of women who have unplanned pregnancies thought they understood the fertile window of the menstrual cycle, but actually didn't. So it's a significant cause of unplanned pregnancy, women thinking they understand their menstrual cycle when they don't. And the flip side is that it may be a substantial contributor to women not conceiving and unnecessarily seeking assisted reproductive care. At the very beginning of this interview, I mentioned to you that we had a program here in Australia on the IVF industry, and the program name is Four Corners, and one of the IVF people interviewed in that program suggested that maybe up to 40% of people who go to IVF probably don't need to be there. And one of the things that they do need to look at in order to optimize natural conception before resorting to IVF is understanding the fertile window of the menstrual cycle. So this is something that is beginning to filter through the levels of or the layers of healthcare, that this is important. Women don't have good knowledge, and in the area of infertility, they may be seeking very expensive, highly invasive treatment that is associated with increases in morbidity or mortality for both women and children, but the women might not really be needing it. But they're being referred to these clinics because women themselves don't have good knowledge, and neither do the practitioners who are referring them on to these centres.
Yeah, I feel like it's kind of the implications of not having this knowledge are just, they can be so great. So the implications of thinking that you fully know it and don't, in this case, can be so costly, and just, yeah, I think that I would be curious as to why this particular issue, this particular situation falls in the way that it does. So when women really believe that they understand their fertility when they don't. And I'm not, I would love to hear your thoughts on it as we kind of move towards the end of our interview today, because I'm not sure, what is it about a woman's fertility? Why do we, and we all do it, because like I said, before I learned through other women, I read the book and I thought I knew everything too. So why is it that we wear it as a badge of honor? Is it that we think that because it's my menstrual cycle, I must know? Or, why do you think that we're all so overconfident about our knowledge when, some of us are have no idea?
I think that the 28-day menstrual cycle construct is ubiquitous. It's everywhere. It's what young people, young girls in particular, learn about in school, and they in discussing the 28-day menstrual cycle, women are given a rhythm understanding of the fertile window of the menstrual cycle. There's a lot of reluctance, in my experience, in teaching women how to understand their fertility on an individual level, so that they do actually understand when they are fertile and when they are not in the cycle, because that would require detailed discussion about the menstrual cycle. It's considered a deeply personal aspect of a woman's health. It would mean talking about mucus, which people might not feel very comfortable about. Some people think that, well, if you teach girls this about the menstrual cycle, they might actually use it. So there is a reluctance to teach girls because they don't want girls to practice a natural approach to contraception. My answer to that is that young people are more likely to make a mistake not knowing than knowing or understanding their menstrual cycle. And then around that, you've got health science courses for doctors, naturopaths, nurses, who are still really talking about the 28-day menstrual cycle. So the 28-day model sort of starts off very early in a girl's life, her understanding of her menstrual cycle in that way, and then it's reinforced in all sorts of ways, magazines, books. When they see practitioners, they have more of a 28-day model understanding. So it's really difficult to kind of break that pattern. And for women to be able to have better knowledge, they really do need to go beyond the normal places that they would go to get the knowledge. So it would be beyond their general practitioner. It would be beyond their average naturopath. They really do need to go to trained teachers. And increasingly there are trained teachers out there. I run a professional development, I run two actually, teaching health professionals how to teach women an understanding of their menstrual cycle. But it's slow. Things that counter development in this area is the when young girls go to, say, their GP to talk about contraception, they're not really educated about their menstrual cycle. They're really told about how to take the pill for maximum effect. Mm-hmm. So the golden opportunities are missed. And I think that things are going to get more difficult in this area because I know that in America and here in Australia there is great interest in long-acting reversible contraceptive methods like LARC. And I think that if women want to use these methods, then absolutely, if they choose them, with full consent, choose to use them, I think if they choose that, then that's fine. But I think that with these methods, they won't have a cycle at all. I mean, even on the pill, it wasn't a natural cycle, but at least it did sort of match to some extent their actual cycle. The pill cycle would the 28-day pill cycle sort of match to some extent a monthly cycle. On these long-acting reversible contraceptives, women won't have a menstrual cycle at all, or a good number won't. Once it's been in for a period of time, a good number of women won't have a cycle at all. That's with Implanon I'm talking about, and the other LARC method is Mirena. So with Implanon, I think about a third of women don't get a menstrual cycle at all while it's in place. I'm not quite sure what the statistic is for women who use LARC, but I understand that it works very similarly to Implanon. So women are being sort of removed further and further from knowledge and understanding of their fertile body. I think contraception is very important, and I think that women should be supported to use whatever method they feel is right for them. But with the movement towards long-acting reversible contraceptive methods, I think perhaps people will become some practitioners will become even less skilled in teaching women about the menstrual cycle, because that will be their approach to contraception or their first-line approach to contraception. So there will be less opportunity of talking about the actual menstrual cycle as women experience it.
Yeah, no, by not talking about it, by not acknowledging it, by not understanding it, and also by having if you don't understand it, then you don't even have the knowledge, like you don't even have the vocabulary to talk about what a disruption in the menstrual cycle could mean. And
That's right.
Well, and I'm sure many women listening have found themselves in a doctor's office where they've gone in for a specific menstrual cycle issue, whether it's irregular periods that are coming, not when they're supposed to, or just like the examples that we gave with long periods between periods, haha. But what is the only thing that your doctor typically will tell you, regardless of what the issue is, regardless of it, if it's irregular periods, painful menstruation, ovarian cysts, fibroids, regardless, endometriosis, regardless of what you come in with, the solution is always just the pill.
Yes, sadly, that is too common a response. So rather than helping a woman understand her menstrual cycle and the underlying causes of it being irregular or having painful menstruation, it is to take the pill. And by not addressing the root causes means that factors that are affecting their health remain unaddressed. So they might go on the pill and they might get a regular bleed, but the underlying causes of the irregular cycle or the painful period are not being addressed. And they can often easily be addressed, and they should be addressed, because they can, not being addressed can have long-term impacts on women's health. For instance, if women have polycystic ovaries and the only solution is to take the pill, it means that the pill will regulate the bleeding, but women need also to have information about how diet, exercise, sleep, etc. can address the root cause and improve a woman's overall health and well-being. And then when she comes off the pill, her cycle might be naturally more regular, rather than just going back to the irregular cycle the woman had before she actually went on the pill. Yes, I see that all too often. It's disappointing.
Mm-hmm. Well, to wrap up our interview today, just a couple questions, and they're probably the same questions that I asked you the first interview. But what would you say is the biggest myth about fertility that you'd like to see corrected?
I guess I think there are two, actually, that spring to mind, and if I gave it more thought, there would probably be many more. But the first myth is that a normal cycle is 28 days, whereas a normal cycle or a healthy cycle is monthly, and variability across the year from 27 to 36 days is quite normal. The other myth is the idea that if you just simply have sex, you'll get pregnant. And we know from solid research that your chances of getting pregnant relate directly to the timing of sex in the cycle. And if a woman has sex outside the fertile period, there's virtually no chance of getting pregnant. A woman has her biggest chance of getting pregnant if she has sex within the 3-day window just prior to actual ovulation. So timing is everything in terms of women wanting a natural approach to contraception or to optimize conception. And a woman's chances of getting pregnant, for those who are attempting pregnancy, a woman's chance of getting pregnant increases the more often that timing is correct. So women often think, I've had sex, I should get pregnant. Well, it depends on where sex occurred in the menstrual cycle and it often takes correct timing over a number of cycles, a minimum of 6 months or 6 menstrual cycles, in order to optimize natural conception.
Yes, and that leads me right into the next question, which is, what advice, if any, would you give to a couple or a woman who is trying to conceive?
The advice that I would give to a couple trying to conceive would first be have all the preconception checks that should be done before attempting pregnancy. And for that, a woman would need to see her GP. And in addition to having those checks, learn about the cycle so that they can hopefully be pregnant before they start getting anxious about not getting pregnant. And what we know is that correct timing can halve the usual time to pregnancy. So if couples were left to their own devices and not given any education about fertility awareness, 85% would be pregnant at 12 months. If couples were educated about the fertile window and they timed intercourse correctly, then 85% would be pregnant at 6 months. And if you give women that understanding that you increase your chances of getting pregnant, the more often you get the timing right over a number of cycles. And that helps them put the goalpost out a little bit further rather than hanging on to each menstrual cycle. And I would particularly encourage people to understand their cycle, seek out a trained teacher in fertility awareness. If they had any underlying problem that might impact their chances of getting pregnant. So if they were underweight, overweight, had thyroid problem, polycystic ovaries, had a stressful cycle, anything that might impact their chances of getting pregnant, I would definitely say start learning about your cycle at the very beginning. Don't wait for 6 months or a year. Start at the very beginning, and you can save yourself a lot of money, a lot of stress, and it can be more in your control rather than not.
Mm-hmm. Well, I think that those are amazing words to end on. Kerry, I just want to thank you so much for coming on the show again. I just love being able to draw from your wisdom. I really appreciate the work that you've done in this field, and I really hope that the information and teachings that you've brought to light with your studies will make an impact on this world, and hopefully will get some of these GPs and naturopaths and everyone really educated about it, because every single time a woman learns about how her fertility works, the first thing that she says is, why didn't I learn this in junior high?
You're absolutely right. In fact, if we could just finish on one more note, in both the surveys that I did of women, in the free text section at the very back of the survey, that was the most frequent comment by women attending general practice and attending art clinics. That was the most frequent comment. I should have learned this at school. And I felt silly for not knowing it at the age I am now.
Yeah, I get emails like that all the time, and I don't know how to break the system. People break the internet, but can we break the system and get this information just out there? I mean, I'm trying, but
I think you're doing a very good job, because I know of people here in Australia who are accessing your website.
That's wonderful.
So after doing the interview with yourself last year, several women made appointments to see myself, having heard me speak on the blog.
Mm-hmm. Yeah, that's happened a lot. I know a lot of my guests. If one of my guests, if the listeners resonate with that person, I've heard it many times, and I guess it's like one woman at a time. You just never know, who's listening, and maybe someone is listening who happens to have the power to get this stuff into the curriculum. You never know.
Yes, absolutely. Yeah, I think that that's true. Women are saying, yes, we should get this kind of education in general practice. Why isn't it happening? Well, the study helps to explain some of the reasons as to why it's not happening. So yeah, it was a good study.
Mm-hmm. Well, thank you so much for being here, Kerry. Thank you again.
Thank you for having me. It was a pleasure.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/83. If you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. And make sure to head over to fertilityfriday.com and join my email list. If you have an idea for a podcast episode or guest suggestion, shoot me an email at info@fertilityfriday.com. Thank you so much for hanging out with me today. I appreciate all of you for taking the time to tune into the podcast, whether you're on the go, if you're taking me on your drive to work, or if you're out walking your dog. Thank you so much for hanging out with me. And as always, until next time, be well and happy charting.